Hey everyone, this is Greg Staley from Diverge Media. Today in the news, we're going to briefly talk about the farmers sounding the alarm on a potential food shortage in Canada due to government COVID-related actions. And we're going to delve into the origins of social distancing just in case you missed our latest article. All right, let's get into it. Starting with the origins of social distancing, this is one that people need to understand. Where did the idea of school closures, for instance, come from? Where did the idea of physically distanced workplaces come from? Would it matter to you? Would it change your mind if somebody had told you that a 15-year-old's science fair project was the origin of that policy, of these policies that have kept us away from family, that have fundamentally changed the way we work with one another? Would that change things for you? Because that is the reality of the situation. So let's get into it. Now, if you go to divergemedia.ca, you can check out the article. Lockdowns and social distancing originated from a 15-year-old science project, Models Run Your Life. Now, looking at the study itself, you can see that Albuquerque Public High School is cited as an author affiliation. That's because Laura Glass put forward the study with the help of her dad, Robert J. Glass, while she was in high school at the time of the model's creation. Yes, Laura Glass was participating in the Intel International Science and Engineering Fair in 2006 at the time that the Albuquerque Journal reported on her project. Believe it or not, the story was even reported in the New York Times. The New York Times said this: Dr. Glass piggybacked on his daughter's work to explore with her what effect breaking up these networks would have on knocking down the disease. So they said the outcome of the research was startling. By closing the schools in a hypothetical town of 10,000 people, only 500 people got sick. If they remained open, half the population would have been affected. Now, keep in mind, this is a model, garbage in, garbage out. If the inputs are not good, then the outcomes will not be realistic. And that is what modeling does. And we have seen consistently throughout the COVID narrative, modeling be off time and time again. Even the low projections have been high in the past. So what did the actual model account for? What did it say? There are 5 strategies that were implemented. The study said that the school closures were increased, that school closures with increased home interactions among children and teenagers that were doubled were considered, as well as children and teenagers social distancing. Adult social distancing with increased household contacts, all children and teenagers, and 90% of adults withdrawing to the home when symptomatic, and social distancing while at work, where contact frequency within work groups was reduced by 50%. So they reduced the workplace contact frequency by 50%. 90% of adults withdrew to their homes when symptomatic. Not arguing per se that input, but the children and teenagers social distance. Okay, so those are the basic premises that they worked with. Then they ran 100 different simulation with it 100 different times, and they did the different strategies together as well, and gave their results. And so they said, it would cut it down. Half the town would have been affected. But here's the issue. Let's get into the nitty-gritty of the actual model they used. One of the first critical assumptions that's false that the model makes is that teenagers and children will be spreaders of the virus. This is because the model is based on the infectivity rates of the Spanish influenza pandemic of 1918-1919. The second false assumption that the model makes is that asymptomatic individuals spread the virus at half the rate of symptomatic individuals. Yes, you heard that right. They want to assert a known falsehood in the model, and that is that that asymptomatic individuals are half as infective as symptomatic individuals, something we know absolutely to be false at this point in the quote pandemic. So the study assumes that half of the infected individuals in the model are asymptomatic. So it starts with 10 infected individuals. Half of them are symptomatic, half of them are asymptomatic according to the study's model, but asymptomatic in the model means half as infective as symptomatic. So the question remains, if an asymptomatic person infects someone else, is there a possibility that they could become asymptomatic and be half as infective in the model as well? So already off the hop, the asymptomatic being half as infective as symptomatic individuals is an absolute falsehood, means the model should be tossed away. But what else does the model say that should be concerning, that this is still being used as the crux of the science 1 year into the quote pandemic? Draconian measures, keeping children away from each other, keeping distance in the workplace, keeping family distance from each other, preventing them from seeing each other. And for what benefit? Where did this come from? What was it based off of? A 15-year-old's science project that had fundamental flaws in it. Not only was the asymptomatic transmission presumed to be half as symptomatic as symptomatic individuals, but we know this to be a falsehood because of a study out of Wuhan, China. Now, asymptomatic transmission, as far as I'm concerned, is not something we should be concerning ourselves with when it is in regards to COVID-19. This is because a recent study out of Wuhan, China, showed that out of roughly 10 million residents that were tested with the PCR test, 300 of them came back as asymptomatic positives, meaning they had a positive COVID test. On further viewing of the evidence, however, none of the 300 positive PCR tests from the asymptomatic individuals were actually viable, meaning actually able to infect another cell, meaning they weren't infectious at all. So asymptomatic individuals, out of 10 million residents tested, 0 of them were actually infectious out of the 300 that actually tested positive. Not only are asymptomatic individuals extremely rare out of the total population, but none of them were actually infectious when they were tested in a lab. The study itself says that virus cultures were negative for all asymptomatic positive and re-positive cases, indicating no viable virus in positive cases detected in this study. Now, the model tells us that for the infectivity similar to that of the 1957-58 Asian influenza pandemic, targeting children and teenagers by not only closing schools, but also by keeping these age classes at home was effective. It continues by saying, however, given uncertainty in the infectivity of the influenza strain, underlying social contact network, or relative infectivity susceptibility of the young versus adults, planning to implement strategies that also target adults in the work environment is prudent. It's likely this line of thinking that led to the introduction of the study's ideas into public policy today. The fear of the unknown and the desire to be prudent. However, what is the government of Canada's excuse today for the implementation of such draconian measures? We know that they aren't an effective means unless absolutely draconian and you shut absolutely everything down and just trample on rights and stop caring about human beings altogether. Then maybe it could be effective. But as it stands, marginally effective at best, but in general, not showing much of a difference between states and places that locked down versus didn't lock down in the long run. The study continues by saying that implementation of social distancing strategies is challenging. They likely must be imposed for the duration of the local epidemic and possibly until a strain-specific vaccine is developed and distributed. It's interesting that they know that the vaccine could also be the end game and that these measures would hold until that end game could be met. If compliance with the strategy is high over this period, an epidemic within a community can be averted, it says. However, if neighboring communities do not also use these interventions, infected neighbors will continue to introduce influenza and prolong the local epidemic, albeit at a depressed level, more easily accommodated by healthcare systems. So in their estimation, this is a good idea because it prevents the overwhelming of the healthcare system. Again, looking at it through only one lens, but again, we must be, as they say, prudent and keep in mind that it is a model. And if the model has fundamental flaws in it, it is going to have fundamentally flawed results. Even the model is essentially saying that 90% compliance must be followed in order for the measures to work effectively. Isn't that fantastic? The other obvious issue is that the model is based on a virus that has infectivity nowhere near that of COVID. It was based on the Spanish flu, and it also assumes that asymptomatic individuals spread the virus at half the rate of symptomatic individuals. At the end of the day, if this is the only science holding up social distancing and lockdowns, it is time to hug again. Let the economy return to normal. And that is if you care about the science. That means the removal of all governmental barriers. I'm not going to hold my breath. All right, now let's move on to the Norfolk farmers who have sounded the alarm as of today on a potential food shortage unless immediate action is taken by the government. Let's get into it. Our article from today, divergemedia.ca, you can find it. Stop the food shortage. Norfolk farmers call for immediate action to prevent shortage of outdoor fruit and vegetables. Norfolk farmers are sounding the alarm. Unless the government of Canada steps in and provides immediate solutions, a shortage of outdoor grown affordable fresh fruits and vegetables in 2021 and beyond is a realistic concern for Canadians. The letter detailing the concerns came from the farmers of Ontario's garden and was posted to independent MPP Randy Hillier's social media. You can find the letter in here on our website in the article itself. Check it out there. But continue reading from our article. Farmers from all around the area gathered in Simcoe today at Simcoe Square to hold a press conference voicing their concerns about the current crisis. Before the press conference took place, a convoy of tractors lined Highway number 3 to draw attention to the troubling situation that is presenting itself. The convoy kept coming to the surprise of many. It was a great turnout, a crowd that would have been even bigger had farmers not had to been present on the farm to continue working. This only highlights the magnitude of the problem that is facing Norfolk farmers and by default, Canadians. The letter reads, our hands have been tied by our local Haldeman Norfolk Board of Health Section 22 order as it pertains to a 3-man per bunkhouse quarantine regulations and the new federal government switch testing procedures. These two requirements together have made the worker quarantine unmanageable from both the growers and the Haldeman Norfolk unit standpoint. The recent imposed letter of instruction pursuant to regulations enforced by Haldeman Norfolk Board under the regulation was sent into area producers in an email on Sunday evening, March 14th, 2021, and was effective 12:01 as of midnight, March 15th. 2021. So they give them a day's notice. Here's the changes. Here you go. The letter actually points out a logic issue with Haldeman Health Unit's orders, and it says the following. Employers of temporary foreign workers were on their own as far as getting the workers to their places of quarantine, limiting the number of workers who may travel together to quarantine cohorts. This is a major flaw because the letter says that safe travel instructions for Haldeman Norfolk Health Unit for temporary foreign workers from the airport state that employers of temporary foreign workers were on their own as far as getting the workers to their places of quarantine, limiting the number of workers who may travel together to quarantine cohorts. There's a major logic flaw in this order as well. It doesn't make logical sense, as the farmers point out. No regard, they said, is being given to the fact that workers previously traveled from their home countries in a plane together. In comparison, again, this is different from every other health jurisdiction in Ontario and, in fact, Canada. Essentially, farmers often have to rely on temporary foreign workers to help get the crops harvested. Now, they're being told and limited they can't quarantine the way they used to. They can't have them come in the way they used to. They have to go through a new procedure, and it is a major hindrance on them, and it's costing them a lot of money, and they're on their own. They're out this money on their own because of the changes that were put in on the 14th and effective midnight of the 15th. So they obviously have a major issue with it, and these workers are flying in on planes together. Those planes have recycled air, so they're breathing the same air and being exposed to the same potential infection. Can't get the workers, can't get the crop done, can't get the crop done. There could be a food shortage, and they're sounding the alarm because of it. The letter continues, the above order and letter of instruction are all exclusive to the Haldeman Norfolk Board of Health region and have made on-farm quarantine of temporary foreign workers an extremely difficult and unrealistic expectation to the majority of farmers that employ temporary foreign workers. The letter concludes with a harrowing statement. Unless immediate solutions are developed and taken in the coming days and weeks, a shortage of outdoor grown, affordable, and safe and fresh fruits and vegetables in 2021 and beyond is a realistic concern for Canadians. This is a serious concern. We are having farmers blow the whistle about a potential shortage of fresh fruit and vegetables from Canadian farmers. Write your local MPP, let them know that this is a problem that needs to be addressed immediately, and help needs to be given to these farmers. If they want to take the draconian approach, there's not time to debate the politics of it, but if they want to take the draconian approach of quarantining all the temporary foreign workers, then they need to help in the short term with those costs so that this isn't coming out of pocket for these farmers who are struggling to figure out how they're going to get their labor here and afford to quarantine them before they can actually work. This is Diverge Media's Greg Staley signing off. Thank you for tuning in. Join us for our Sunday show with our newest correspondent, Paul Staley, as we talk about what's in the news cycle and the important stories that have slipped through the cracks. Everything to make you glad, sad, and mad in the Sunday show. Thanks for tuning in, and we'll see you next time.